Risk factors associated with leukemia are multifaceted, encompassing exposure to hazardous substances and inherent genetic predispositions. Notably, individuals with conditions such as Down syndrome exhibit higher incidences of this malignancy. Therefore, comprehending these risk factors is essential for devising effective preventive measures. Among the various types of leukemia, acute lymphoblastic leukemia emerges as the predominant form in pediatric populations. Epidemiological studies have consistently indicated a greater incidence of this disease in males compared to females. This observation underscores the critical need for focused research and tailored treatment methodologies. The pathogenesis of leukemia is characterized by distinct stages, including the initiation and subsequent progression of the disease. A comprehensive understanding of these stages is vital for the development of effective therapeutic strategies that are specifically aligned with the unique characteristics of leukemia. Acute leukemia is marked by its rapid progression, necessitating immediate medical intervention to avert severe complications. This form of leukemia is particularly prevalent among children, thereby highlighting the urgent need for prompt diagnostic measures to facilitate timely treatment. In contrast, chronic leukemia often remains asymptomatic during routine medical evaluations, which can lead to delays in diagnosis and hinder effective treatment efforts. Symptoms may not manifest until the disease has significantly progressed, complicating the clinical management. The treatment landscape for leukemia encompasses a variety of modalities, including chemotherapy, radiation therapy, and stem cell transplantation. While certain variants of leukemia may be amenable to curative interventions, others require ongoing management strategies to effectively control the disease. Specifically, chemotherapy for chronic lymphocytic leukemia, CLL, varies in intensity and regimen depending on individual patient diagnoses. This variability underscores the critical importance of personalized treatment strategies aimed at optimizing patient outcomes. Patients diagnosed with CLL frequently experience immune suppression as a consequence of dysfunctional B-cell activity. This impairment leaves individuals more susceptible to recurrent and severe infections, thereby adversely impacting their overall health and well-being. Common manifestations of CLL include anemia, persistent fatigue, and weight loss, which collectively exert a significant toll on quality of life. These symptoms often signal underlying systemic health issues, warranting comprehensive clinical evaluation and intervention.